Psoriasis in 3 words: dry, scaly, itchy.
Volcanic Chinese burn with someone pouring lemon juice all over you.
It's really ugly and it looks really uncomfortable.
Itchy. You want to scratch it.
I would do anything to get rid of my psoriasis tomorrow. Absolutely anything.
My name is Dr. Stuart Wolfman and I'm a doctor with a special interest in dermatology. I've been treating psoriasis for more than 30 years, but that's not my only connection with the condition. I'm also a patient. I was diagnosed with psoriasis more than 20 years ago, and I'm very lucky that I've been spared the more severe type of psoriasis, but for some patients it can be very debilitating. Today there are more than 125 million people living with psoriasis, and this number is continuing to rise with no cure in sight. We set out on a journey to help healthcare professionals better understand this increasingly prevalent condition and to meet the people who live with psoriasis every single day. Rena Romani is from North London and was first diagnosed with psoriasis at age 13.
It kind of literally just came overnight. I had like a heat rash on my back, and my mum even thought it was a heat rash, and then within days it started to spread on my arms and my knees and stuff, and then they just popped, the spots popped. So we went to to see our GP, and I was diagnosed like almost straight away. And what haunts me all the time is when they kind of said, you've got psoriasis and this is for life and there's no cure. I still sometimes sit back and think, what do you mean there's no cure? 24 years and no one's still figured out how to control this like for good.
I first developed psoriasis when I was 12. I was out in the sun one day, covered in psoriasis the next. And that had quite a big impact on my life, because at 12, to have that kind of appearance, going from very normal skin to then very dry, cracked, scaling skin. And to do that, and my skin audibly crack and bleed was quite difficult to deal with then. And people associate skin disease with a certain social class, a level of cleanliness, and judge you because of that.
My daughter Gabby has just had her first experience with psoriasis, and although it is mild, she's worried about what it could mean for the future.
I was a little bit worried and I wasn't expecting it, so it was a bit of a shock to me, and it was a bit of a sort of something to get used to, because to have to combat it for the rest of my life. Kind of felt like I had struck unlucky, because I'd seen my dad suffer it for ages, and I was like, oh, it's fine, it won't happen to me, and it did.
My life with psoriasis is very long-standing. Since about the age of 30, I've had psoriasis, mainly on my elbows and on my knees, the chronic plaque type of psoriasis. And in fact, my dad had the same, and my brother had the same.
I've gone through a number of GPs in the same practice, and then when I've moved house, the same again. Because it's almost as if they have a list of, we've tried that, now let's try that, now let's try that, without thinking what it is they need to achieve with psoriasis. But they don't think about the symptom, the kind of treatment the patients will want, how long they're likely to use it for, and recommend or prescribe a particular treatment for that patient.
In spite of the fact that up to 90% of patients suffer from itch, this symptom is often ignored when managing psoriasis.
It is a traditionally held view that psoriasis does not itch, but other skin conditions such as eczema do itch. Interestingly, we hear a very different story from people who live with the condition every day. Psoriasis does itch for many people, it is extremely uncomfortable for many people, and it is unfortunate that so many textbooks and articles state something different.
I think there's a lack of education out there. I sometimes get really frustrated with the healthcare professionals, because it's like, what do you mean it doesn't itch? Itch is like mad. I've been to see consultants in the past, and they say, well, psoriasis doesn't itch. You have no idea what you're talking about.
I think when patients start scratching their skin, the first thing that comes into mind is that they've got scabies or some infectious disease. This is not the case. People often scratch their skin when they're anxious or when they're nervous. But in psoriasis, they scratch their skin when the skin gets very dry. It's often very satisfying to scratch a plaque of psoriasis. Jack is 92 years old and lives in North London. While his psoriasis is well managed and doesn't affect his life too much, The itch bothers him.
It's been with me for some years. I can't remember exactly how many, 10 at least. I think stress brings it on. I feel when I have a lot of pressure, it seems to erupt. It's not something I've accepted happily. It's a very itchy skin, which is not pleasant because you scratch. And it's not embarrassing because it's very private, but it's alarming because you just don't want to scratch. It doesn't look nice and doesn't feel nice.
The itching is ridiculous. Like, sometimes I've scratched during the night so badly that the bed sheets are covered in blood, my pajamas are stuck to my skin, like I've caused like tears, I've caused infection because of my nails, itching, I've ended up actually being admitted into hospital because my psoriasis has been so severe.
I would say that psoriasis is itchy, but not in the same itchy as mosquito bites when you're on holiday. It's kind of like a more of a localised itch, and it's kind of a bit more of a tickly itch that you just kind of a bit more reluctant to itch because you know that it opens up and becomes way more kind of like moist and sensitive and ugly.
While non-sufferers refer to psoriasis as just a skin condition, it is often the psychological burden that is the real problem.
For years I didn't speak about it. I bottled it up for years because I didn't know how to. I didn't know if it was acceptable for me to have these kind of thoughts with a condition. It's like, why would people associate it? Why aren't you thinking out of the box? I'm not just coming to you because I need a tube of cream or blah blah blah. Like, have you asked me what mental state I'm in because of this? Because it's not just like applying the creams. It's so exhausting. You don't sleep properly. Like, it affected like my sleep, my appetite, everything. So if you then put all that together, there's like a massive strain, and it's just not looked at.
We know that there is a psychological impact of psoriasis. We do hear from people that they do struggle with depression and anxiety sometimes. The stress of having the condition can be quite profound, and certainly from the point of view of a lack of control. People often find it difficult to deal with the fact that even if they have their psoriasis under control with treatments, that it may come back at some point in their lives. And so that can be quite a difficult thing to come to terms with. Some people find themselves in something of a vicious cycle where stress can trigger their psoriasis, and then having the psoriasis or having their psoriasis flaring can then cause them to feel more stressed and anxious. And so it is really important that we're viewing people as an entire person, and we're not just treating the symptoms that we can see, but we're also asking them about things like itch and pain and fatigue, and working on improving those things that can really affect someone's life.
The obvious thing patients want is a cure, but in the absence of this, what are we missing from treatment?
Ideally, I'd want it to just bed psoriasis and cure it, but I know that's not going to happen. Something that's convenient, that works, and everybody's different because what works for one person might not work for another. I think there's never going to be getting away from moisturising and applying creams and stuff, but I think just something that works and is not so messy.
If something new comes out, I need to know, because I don't read women's magazines, I don't read health stuff, I don't read OK magazine kind of thing. I don't read those pages of a newspaper, so it's highly unlikely that I'm going to know about a new treatment. And what I'd like to see is the GPs having a bit more motivation that if we've got somebody with psoriasis, let's get them back in because there is something new we can offer them.
Psoriasis is different for every person that has it, and so it can be difficult for a healthcare professional to completely understand how that condition affects that individual. Unfortunately, with treatment of psoriasis, it's a real one-size-fits-all approach. There's a very definite process that needs to be gone through, which is great for many people but doesn't necessarily work for everybody. And so it is important that a healthcare professional is talking to that person and really understanding about what's important for them and how their psoriasis affects them.
As healthcare professionals, we can be victims of a lack of education where psoriasis is concerned. Undergraduates only receive 2 weeks of training for skin conditions, whereas they represent 10 to 15% of consultations. Having heard from the patients in this film and listened to their stories, the wide-ranging impact of the psoriasis becomes all the more apparent. So is it time for a shift in the way we approach treatment of the condition? Taking the time to listen to the symptoms that affect patients on a day-to-day basis is critical. Whether there's thick scaly plaques, psychological distress, itch and sleepless nights, it's important to listen to the symptoms in order to prescribe the right treatment for the right patient.